The journey of a stroke patient from the moment they enter a hospital to their eventual discharge is a complex and transformative odyssey marked by urgency, expertise, and resilience. When a stroke patient arrives at Manipal Hospital's Millers Road, a meticulously coordinated sequence of events unfolds designed to swiftly and effectively address the critical nature of their condition. The patient's journey begins with our ambulance team wasting no time in getting the patient on board and beginning the journey to Manipal Hospital's Millers Road. Our ambulance staff play a pivotal role administering immediate care en route to the hospital. Paramedics focus on stabilizing the patient, ensuring a smooth transition upon arrival to emergency department. Upon reaching the hospital emergency, where every passing second holds significance, the medical team swiftly takes charge. Nurses and physicians engage in a rapid yet comprehensive information gathering and initial assessment. The patient's medical history, vital signs, and neurological status are scrutinized, forming the foundation for subsequent interventions.
A stroke is a condition wherein there is a disturbance to the blood flow in any one portion of the brain. This can be either in the form of a blockage of a blood vessel or a reduction in flow to the brain, which is called an ischemic stroke, or it can be in the form of a leak of blood or a bleeding into the brain, wherein it's called a hemorrhagic stroke, and the management of both these conditions is quite different.
Following the initial assessment, the medical team conducts a more detailed examination. If stroke symptoms are identified, the stroke team is activated. This specialized team, comprising neurologists, radiologists, and other experts, mobilizes to ensure swift and accurate decision-making.
After a quick assessment, the patient is shifted for a CT scan. The CT scan is basically done to ensure whether the patient has had a bleed or not. If the patient has a bleed in the brain, then the management of stroke is along the lines of a hemorrhagic stroke. If there is no evidence of bleed in the CT scan and there is no evidence of a very large stroke on the CT scan, then the patient is a potential candidate for what is called thrombolytic therapy. A thrombolytic is a drug that can be injected into the veins of the body in order to dissolve the clot that is causing the blockage to the blood vessel.
If there is a major blockage in the blood vessel, patient will be immediately shifted to the cath lab to remove the clot from the blocked blood vessels, and this procedure is known as mechanical thrombectomy. Here we obtain the vascular access in the right groin, then we take the catheters inside this blood vessel and we go to the neck level. Here we inject a dye to see the level of occlusion in the blood vessels of the brain. Once we confirm the occlusion, we retrieve the clot using suction catheters and stent retrievers. Once the clot has come out, we again inject a dye to confirm that clot has completely come out. So after this, the procedure is complete. Now the patient will be again shifted back to the neuro ICU for monitoring.
Following any necessary interventions, the patient is shifted to the intensive care unit ICU for close monitoring. Continuous observation allows healthcare professionals to manage potential complications, assess the patient's response to treatment, and make timely adjustments to the care plan. As the patient stabilizes, the focus shifts towards rehabilitation and recovery. Physiotherapists play a crucial role in designing tailored rehabilitation programs to help the patient regain strength, mobility, and independence. This phase marks the transition from acute care to long-term recovery, emphasizing holistic patient well-being. In navigating this carefully orchestrated sequence of events, stroke patients at Manipal Hospital's Millers Road receive comprehensive and timely care. minimizing the impact of the stroke and optimizing the chances for their successful recovery. The collaboration of our dedicated healthcare professionals and the advanced medical technologies available at our facility contribute to a more hopeful outcome for those facing the challenges of stroke.